All righty, what's going on? Macro perspective peeps. Coach Seamus up in the house. Marcos couldn't make it. Things happen in life and we just got to roll with them. But today we have an amazing guest, Natalie Samson. I want to do a quick intro for her, guys, real quick. I was on a 3x4 genetics call and Natalie was dropping some bombs on nutrigenomics. I was like, yo, I got to get this Natalie girl on the pod. Funny thing, though, she, was at the Integrative Healthcare Symposium the next few days. So we ran into each other in New York, which is all the way across the world, which is insane. But I want to introduce her before that, and we'll talk about how we met. But Natalie, board certified in genetics counseling, master's in all this stuff. So she's a true pioneer of this space. But also at the same time, she has her certs in functional nutrition coaching, all the health coaching certifications as well. And she's even established her own practice, Golden Genetics, where she's serving people in this space in nutrigenomics and counseling and combining that all with health coaching. So her goal is really to have integrated personalized care in the genetic space. And I think it's super, super stringent now. I think the space is booming. It's great. But yeah, Natalie, tell us a little bit about you more, like what got you into the space. And then we could talk about all the little fun things we got into at the IHS as well.
Yeah, thank you so much. I'm so excited to be here and talk to your audience. So when I first started my journey into studying science, I had no idea that genetic counseling was a profession.
Yeah.
It's pretty niche. A lot of people still don't know about it, but I found out about it when I was in my undergrad studying biology, and someone came to us and said, basically, you can get a degree in studying genetics and then communicating genetics results to patients. So the degree is a mix of studying the actual scientific piece of genetics and then the counseling psychology piece. And I felt like that was in alignment with exactly what I wanted to do, because I always wanted to work one-on-one with patients. I love genetics. I love understanding the human body, but I didn't want to go, I really didn't want to go to med school. I actually didn't even like blood. So I'm like, well, how do I balance these two worlds? And so, and then the more I got into it, the more I just started understanding the power of understanding our DNA and how it's so underutilized. And, no one really, I think people still think that genetics is just for rare disease or for ancestry. And a lot of people still don't know that there's so much power in it, in like personalizing, your health. So, that took me to start my own practice, but I'm just obsessed with all things DNA.
Yeah, no, that's cool. That's a great obsession. I'm kind of the same way. I was thinking about this today when I was going through my undergrad and I was in the higher level physiology classes, and we were going through like the glucose phosphate 6 kinase routines and then glycolysis Krebs and then all the ATP PCR systems. And I was like, the body does this in the middle of class. And I was like, this is amazing. So I feel like we share in that space of like, just like awe of the human frame.
So true. I know. This is such a funny story, but I remember when I was first studying the specifics of genetics and the central dogma with DNA, RNA, and protein, and just understanding and being in awe of how, this teeny tiny genetic material creates everything in our bodies. And I literally remember tearing up in my lecture because I was like so excited. Calling my mom to an undergrad and being like, this is the coolest thing ever. And she's like, okay, I think that you found what you're supposed to do.
Yeah, I think you did. And now you're serving people in that space. It's so funny. The reason I wanted to get you on the pod was because I felt that passion. I felt that passion at the 3x4 Genetics, which is one of the vendors that you guys use, and we use them here at Centergenics, and it's just amazing. I love Dr. Yael Jaffe's work, and that 3x4 Genetics was probably the first time that I understood what lifestyle genomics was. Not genomics for disease. I think disease is a different category of its own in genetics. There's just so many frameworks for genetics. So we're gonna go deep into the stuff. But when I saw you, I was like, let's get her in. But funny enough, I think a few days later, I'm like, hey, jump on the pod if you want. Then 2 days later, we are in New York and I see you. And it's like, hey, yo, Natalie, what's up? And like, let's tell the audience about what happened in New York, how like that transpired, how that created like a bond that was like insane.
Yeah, like immediate. Yeah, if you want to excel your friendship, you have to try this.
Yeah.
So, The conference was amazing, and the opening speaker were, I think, two monks. At least one of them was a monk, but they were
Yeah.
really into mindfulness and meditation. And so they had us do an exercise where you basically turn to a stranger next to you and look into each other's eyes for, like, I want to say it was 5 minutes. That might be just my head. It can get
Yeah.
longer. And the monk was leading us through just, conversation. Like, he was basically talking while we were doing that exercise about, how you're looking into someone who, is aging and will face death as a human. And it was such a powerful, intense experience. And you know me, I was like so uncomfortable at first, but I feel like it just connects you to the human so quickly.
Yeah. No,
So
no other way to break the ice than, hey, meet a stranger, look into their eyes for 5 minutes, and
yeah.
and go through this conversation. So I believe there are practices called contemplative medicine, and it was like, imagine this person aging, imagine this person with wrinkles on their face, imagine them, imagine them with their loved ones, send them love, send them gratitude. Like I was like, yo, I'm going everywhere in this 5 minutes.
I know. Yeah, I know. So powerful. It was like, he even was saying something like, what if the person in front of you has a chronic disease or, is in pain, and all these things. I feel like it really just makes you have empathy, and just kindness to whoever, because, I feel like we get so wound up in our own lives. So when you're remembering that whoever you're talking to or interacting with is going through their whole own story, and they have their own loved ones and they're
Yeah.
aging, like you said, it's just so powerful.
No, it's powerful.
Cool.
I think that goes into the counseling part of it, right? Um, Obviously your work with Golden Genetics, your company, want to shout them out as well. Um, Tell us what made you decide, hey, I want to kind of do this on my own. I know you kind of told me a story there, hanging out with you over the weekend, but like what made you decide, hey, you know what? I've been in this space, I got my master's, I got the boards, I got all the right things. But you were doing something before, and what initiated you to go, "Hey, I want to put my own spin on this." Can you tell the audience about that a bit?
Yeah, definitely. Yeah. So in genetic counseling, we're mostly trained a lot of times in disease risk and disease genetics. And so that's like genetic testing to assess for high penetrance, which we'll probably get into, but high risk conditions, or also giving a diagnosis of a certain condition. And so when I was going through grad school, I was flip flopping between what specialty I wanted to go into. And I decided to go into cancer and neurology. So mostly focusing on Alzheimer's within neurology. And the reason I went into those two specialties is because I could see the power of understanding your genetics before you actually have any symptoms for those conditions, so that you have the ability to be preventative and proactive.
Yeah.
And so when I graduated, I worked at a hospital in those two specialties. And like you had mentioned, um, I kind of was starting to feel unfulfilled, because in the Western traditional world, when you're giving risk information about cancer or Alzheimer's to people who don't have it yet, we really don't talk about nutrition and lifestyle. And we know those two conditions are so influenced by, like lifestyle, nutrition, and also just environment. And so all I was able to do was talk about screening, surgeries, and pharmaceuticals. So
Mm,
I was feeling disconnected from that. And,
mm,
I was having patients who were passing away. And then I was seeing their children the next week after, their dad just passed away from pancreatic cancer. And then, they would ask me like, well, what can I do to avoid this condition? And being in that setting, I felt pretty constrained to only talk about screening, surgeries, and pharmaceuticals when I know there was so much more. And so,
yeah.
you know, at that same time, as I've shared with you, my dad was going through his own diagnosis of cancer. And I kind of hit a point where I was like, I can't just sit here and have this veil, over my head and not really give and help people the way I know that I could. So
Yeah.
that's when I, pursued further education in the integrative space and left to start my practice to bring that approach to
Yeah.
patients.
Which is amazing. I think people need that integrative approach, not everyone is ready or is needing a pharmacological or a surgery or like a procedure. I think there's
Mm-hmm.
more things down the line that's preventative.
Yeah.
Yeah, we shared, our different takes on our fathers having cancer.
Yeah.
And I felt like when I had that conversation about my stepfather, when I reflect back on his cancer, I felt like his father and his family, like they're all living really well. Now, look, cancer is unforgiving. It doesn't care who you are. You could be a baby, you could be an old man, you could be a young person starting your life. Um, it doesn't care. It's E for everyone. It does what it
Mm-hmm.
needs to do. So I'm not going to take that and say it's not. But obviously, lifestyle plays a big part in that, right? So like the genetics component and the lifestyle. And I don't think he had set himself up for a lifestyle that was at least lowering his risk or his high penetrance or low penetrance there. Um,
Yeah.
so I think that counseling part, that integrated, the preventative is important for someone. And I think it's hard because everybody has like a framework that they're living with. And if cancer comes, cancer comes. But for the folks that are listening today, maybe we could talk about that. Maybe I don't know if that's truly like the specialty you want to cover today, but we can cover like cancer, Alzheimer's. Those are like disease states that the risks most people are probably thinking about, right?
Yeah.
Um, when you're going over that with somebody and like kind of understanding those components, we don't have to go too deep into the science. I know that that's part of a counseling session, but
Yeah.
what are some of the components that you look for in a genomics test? And then as you counsel, then you start bridging in that lifestyle, that health, lifestyle, nutrition, and all that.
Yeah. Yeah. And I always say that genetics gives us the chance to prepare rather than react. And,
Mm,
because because our healthcare system is very much focused in reactive care, that is what I think the missing link that I saw was that we weren't harnessing the true power of genetics the way it could be harnessed
yeah.
with that preparedness. Um, so I actually love talking about cancer genetics because I think that it's a misunderstood topic. So when we're testing you for genes associated with cancer risk, what we're actually looking at are the genes that are responsible for suppressing tumors in our bodies. And so they actually work to protect us against cancer. And so sometimes people can be born with changes or
Mm,
misspelling in these genes. And that gives them less protection against cancer. And so I think that's a good distinction because I think people get confused that they have the gene or they don't, but it's actually, do you have a mistake in the protecting genes?
ooh,
So I always
okay.
clarify that.
Yeah. Can you say that one more time? You have a mistake within the certain genes. Can you just say that one more time?
Yeah, yeah. We're actually looking to see if you have a mistake, also known as a mutation,
Mm.
in the cancer protecting genes.
Got it. Okay, cool.
Yeah.
And so you're looking at the genetics, you want to look at the protective cancer genes. What are some off the top of your head that are pretty easy to talk about and kind of
Yeah.
cover, and what should a person that's listening to this be like, okay, but cancer is cancer protective. So is this the whole body or are these like systems like my heart compared to my pancreas compared to my
Yeah.
spleen or something like this?
Yeah, good question. Yeah. So I think a lot of people have heard of the BRCA genes or BRCA mutations, which the reason is because Angelina Jolie had a bilateral mastectomy because she had a mutation or a mistake in one of these genes. That is, an option. It's not a requirement if you have a mutation in these genes. The reason she chose to is just to remove her risk of breast cancer as
Yeah.
much as she could. So that's something we'll talk about, but it's everyone is, makes their own decisions when that comes up. But, so the genes themselves, each gene is actually associated usually with multiple cancers. And so, for example, the BRCA mutations increase risk of breast, pancreatic, prostate, and ovarian cancer. And so then we know, obviously if you're a man, we're talking about prostate. If you're a woman, more so breast, but it depends, on the mutation and the gene. And
Yeah.
so when we get this information, we will know then what cancers you may be at increased risk for. So there's different things, the way that I approach it. So first, I don't want to rule out how important screening is because screening is a powerful tool. So when I mentioned that, in the hospital setting, so screening is always something I will talk about. And the other aspect is the nutrition lifestyle. So screenings help us be proactive so that we know we can check the areas that gene increases cancer risk. And so we can catch cancer early. And so I always tell patients that cancer caught early is a much different story than cancer caught late. Really, the only reason someone passes away from cancer is that if it's spread and it's at a late stage.
Yeah.
When cancer is caught early, it's usually a minor surgery, and you actually don't often have to do chemo or radiation. And so that minor surgery is way different than going through chemo, radiation, surgery, and then having it maybe work. So
yeah, let's pause on that for just a second. Cancer caught early is better than cancer caught late.
yeah,
Interesting. I'll bring in my stepfather's story here. We this is like I laugh at this story, but so he used to play softball. He fell, and he fell on his back and his forearm. So he had been sore on his back and forearm for like 2 weeks. And Natalie, I'm telling you this as like I was going through my degree in kinesiology, all these things. I was like, oh yeah, just go to the massage, go do some physical therapy for like that back and thing because he
yeah,
kind of fell playing softball or whatever. So he's doing like back massage. He's getting people walk on his back and stuff.
yeah,
And I go off to camping on like a Friday. I come back on a Sunday evening, and he had apparently been in like an 18-hour, 25 specialist surgery over the weekend. Apparently, all we're saying to this guy is go foam roll, go massage, go physical therapy, your back and forearm. Apparently, that pain was from cancer. His spine had collapsed on itself on 2 vertebrae, and then his
yeah.
forearm had a hole in it, and then it had spread everywhere. And basically, in that
Oh,
18-hour time span, like he had like did a few things, and he only had like a few weeks to live. But here's the crazy thing: we had like 2 more years with him, which is insane. We got crazy. Uh, my mother works in like the healthcare system. She was able to move some things forward for him. We got like great insurance, all these different things. But it's interesting how like he didn't even know until he had to be like, oh, my back and my arm hurt. Have
yeah,
you kind of heard of stories like this before where people kind of go in? I think maybe it's a men thing too. Like men don't necessarily get
yeah,
screenings or do their physicals every year. I tell my young guys that I coach, I'm like, hey, you're
yeah.
25, go. They'll find things faster, and you don't have to deal with it when you're 50 and die in like a week or two. You know?
Exactly. No, I know that's such a good point. Well, that's also why I tell people that, genetic testing when we're doing this type of testing, it's not about fear. It's really about the ability to be proactive, preventative, and personalized.
Yeah,
And it really, like you said, it helps people avoid those situations where they go in and all of a sudden it's caught too late because we're already staying up to date on it and we're allowing it to be caught early if something comes up.
yeah,
So, and then the other piece too that I think is important is I will tell people that even though we can't change the genes that we're born with, so we can't change the actual code of the genes that we're born with, we do have control over genetic expression. And so,
yeah,
that's like the epigenetics, and that's where that comes into play. And so we have to keep both worlds in mind. So when patients ask me like, is it nature or nurture? It's actually both. And that's why we need to look at both. And so we can't just, when we're doing DNA testing, we're going to look at what you're born with, but then we need to take into account the epigenetics part too.
yeah. The epigenetics, the lifestyle, the things that truly are what you can kind of control most of the time, right? And really work on. And I think that's where like that counseling comes in, that functional health background, health coaching, nutrition
Yeah.
coaching, and things like that. Yeah, let's get into that a little bit. Um, there's so much there that we can get into, but what are some of the big pillars that if someone says they work with you, they got the screening, they got the golden genetics testing, they're doing a counseling session with you, they've done their DNA, they've looked at all that stuff. Now they got to put a plan into action. What are some of the big boulders you're looking at that are going to cover most of the stuff? And then obviously, when a patient comes in with you, they're going to have some more specifics to their specific situation. But across the board, what are the things you're working on?
Yeah. Well, I always obviously the lens that I view it in is that every choice we make actually does impact our gene expression. So it's, I don't think people think about that, the reason why things may positively or negatively impact them, but it's literally because of their genes. So just for example, to put that into context, if you eat, something that is anti-inflammatory, let's just say turmeric has been shown to shut down the inflammatory genes in our body. And so it turns them off. And so that's what I'm kind of talking about with epigenetics is, turning on and off genes. And so everything that we do, even emotions, and that's why has been really interesting research about trauma being passed down epigenetically, because even like the thoughts we tell ourselves are going to change the expression of our neurotransmitters and dopamine and serotonin and all these things. And so I always tell patients that, if you can view that as what you're doing and remembering that it's an act of self-love and like love to your DNA, or it's not, instead of like, I'm restricting myself, it kind of like helps put into context how it's affecting us.
I think that's a great point, because that's the same place that I come from as well when it comes to like nutrition coaching or exercise coaching. Is like, these are decisions and frameworks that are going to help you where you're at now and get you to your desired goal. But sometimes you have to change the script within your head of saying, oh, I have to eat this, food the way my coach would like me to eat it because I'm restricted to these things. I feel that has like a different connotation than as of, hey, look at these foods. They're really nourishing me. And if I choose to have some of the quote unquote bad foods, I put this in bad, quote unquote, like it's still part of the plan somehow, but I know that I really got to stick to these frameworks as much as I can. I feel like that evolution or that change in their wording really does help in some way.
Yeah, it's so true. That's how I will talk about prevention too, because, I'll have patients that are kind of thinking prevention is black and white, meaning like you either do all the things perfect or you don't and you get cancer. And so it's like you said, it's not that way at all. Reality isn't that way at all. And so even, small choices, but 80-20, it's balance. Like stress plays such a big role in prevention as well. And so we want you to live joyfully. We don't want you to live stressed and, anxious about every choice you make.
Let me just frame this, because Marcos and I talked this a lot about, I wish you got to meet Marcos, but Marcos is like one of the best at this, is where we deal with those neurotic types where, I see this, like, I'm seeing this like right now every week. You probably get this. Maybe we could bring an example where someone goes, Seamus, like, can I have this almond milk? And I'm like, I mean, like, what's wrong with it? Well, there's this guar gum and then this gelatin and then this. It's like, am I gonna get cancer? And I'm like, well, not necessarily, no. And like, and also too, I think like you can't have precision and perfection, because even though you're like watching out for that almond milk and maybe you got the best almond milk or whatever. Well, what are you wearing? Now you're oh my God. There's microplastics in this. And then you could just go down a rabbit hole. And then, have you ever seen that movie Bubble Boy?
Oh my God, I was just thinking that. I was like, you can't live in a bubble. I always tell my patients that. I'm like, we can't live in a bubble. Yeah, it's so good. But I think like the other piece too, this is why I love combining medical high risk genetic testing with 3x4, is because we can also see how to support, like, okay, so if we can't remove everything out of our environment, because that's impossible, like what pathways can we support to help your body remove it on its own? So like like phase 1, phase 2 detoxification pathway, like can we get in some things to help support that if that's not working as efficiently for you genetically? And so, there's kind of like, there's the two pieces there that we can support. And then, like you said, because we're speaking on the mental point, then you just have to let go and also breathe and live and, incorporate joy in your life.
I can't do it, Natalie. I need to know the answers. These microplastics are everywhere. I need to avoid them. All right, stay in your house. I
know, I'm like, you gotta let go. I mean, it's, it's so interesting when you look at like the blue zone research, how I feel like a big part of longevity research that, kind of came up with blue zones is the importance of things that aren't going to be, perfectly in our control and have to do more with mental health, like community and stress reduction and having a purpose and feeling fulfilled. Like those aspects of prevention are so important. And I think I would argue that those aspects are probably even more important than like the exposure you get from drinking the almond milk with the gums. It's like, if you can even just nail down like community and fulfillment and stress reduction in prevention, like that's so big, so
It's so funny you say that. I say that all the time. My day-to-day is like in performance physiology. We're looking at VO2 max, DEXA scans. We're looking at your brain. We're looking at all these things. You look at your lab. I'm like, yeah, but like, what are you even striving for? Like, what are you even living for? Where's your community? Where's your sense of purpose at? Because those things are gonna be bigger factors than like, if there was, I don't know, you drank this water and had a little microplastic. Like, I feel like the human physiology can like, withstand a little thing here and there if you're not constantly exposed to it. I think you'll be okay. But I feel that like that community, that purpose, it comes, and I feel that some folks can get a little anal when it comes to these tests, and they get overly tested. And I feel like that's what I love about the genetics is you do this test once and you have an aggregate of data, and then it can always be updated, right?
Yeah, no, that's what I love about it too. I always tell people that this is a one-time test that you literally are getting lifetime information, about. It's not. So this is what I also love about genetic testing too, is blood tests are amazing and they're also a snapshot in time. And so genetic testing helps us understand potentially the root cause of what could be going on, because sometimes blood tests won't cover everything too, and it helps you know where to start. And then the other piece to it is that it kind of gives us this telescope to see into the future, and again, like be prepared rather than react to what could come up in the future, or again, like be proactive and preventative to avoid it. So like when I'm doing the genetic testing, I love being super specific with it too, on how we can upregulate or downregulate certain genes that are coming up for you, and talk about the pathways and all of that related to what we're seeing in what you were born with. So anyways, I think there's so many benefits to doing genetic testing. I mean, I always tell patients too, it's like, if you like earlier the better. There's certain pediatrics, we usually like to wait until 18, especially for adult onset disease risk conditions. But I always say that, when I was working at the hospital, I saw that we were always getting patients too late when disease was already occurring for them. And again, the goal and really the power of genetics is when we can catch things early. And so the earlier, the better. If you know your body, young, and can be personalized with your approach, it's so powerful.
It is. I got mine done last year. I was like 30 years old. That's apparently the field had only been around for 30 years. So it was like, and like to get it. So you shouted out 3x4, Yael Jaffe, Dr. Yael Jaffe created that company, chief scientific officer. We're going to get her on the pod too. She's the best. I got to shout her out. She gave me the best advice on my speech, and I felt like I killed it. And I'll get that recording here. Yeah, it was good. Let's talk about these things. I mean, so we're halfway through this kind of pod, and I think the audience is going to go, okay, cool. I'm sold. I'm going to go do my testing. Let's talk about some of these pathways. Some pathways that are probably particular. I know we talked about cancer. I think we can move on from that. You talked about anti-inflammatory. I mean, that right there is great, because we don't want to be chronically inflamed or intaking too many things. What are some other pathways that maybe someone can think about as if they're younger, they get that? Maybe I know you mentioned Alzheimer's. Is that, what about that one?
No, I think there's so many genes and so many pathways that we look at. And that's a huge piece of our role too in my practice, is like, we as the genetic counselors want to be that connection to what tests we think would be most beneficial for you to order and look at, because there are so many out there. And also, there isn't one genetic test that looks at everything. So I think that's a common misconception. People have heard of whole genome, whole exome sequencing, where we're able to now sequence the human genome. But the thing is that the lab doesn't report every single variant found in that, because there's over 20,000 genes. There's no way a report.
And
Yeah, so that's like a big role that we play. But yeah, the Alzheimer's, a lot of people are hearing about the gene ApoE. It's definitely something that I love to help people understand better.
Yeah.
It relates to Alzheimer's risk. There are other genes associated with early onset Alzheimer's as well. But ApoE, always will talk to patients before I order this test, which I think, unfortunately, people can sometimes find out this information without knowing they were about to test for it, like 23andMe. But,
Yeah,
because
can we pause here for a second? Like,
yeah.
23andMe is just your ancestry. It's not telling anything about you that you need, right?
Yeah, they've started to add on some genes, but we personally wouldn't use that genetic test for health reasons. The other reason too is it's not comprehensive. There's only like, a couple variants that are on the report, whereas as you know, Seamus, the 3x4 report has, 200 plus genes. So when we're looking at genes in pathway and systems biology approach, we want to look at comprehensive panels, because when we're looking at genes that aren't impactful like single genes, they are working together. And so we want to see how they're working together in a pathway instead of
Yeah.
looking at them individually. So there are certain genes we can look at individually, like ApoE or the cancer genes I was mentioning. But for the most part, the type of genes that we're doing in lifestyle genomics, we want to look in how they work together in pathways. So anyways, with ApoE, it's an interesting gene because it actually has to do with fat and lipid metabolism. And so there are 3 different variants that you can have. You can have E2, E3, and E4. We know in research that having E2 can be protective against Alzheimer's and lower your lipid levels, whereas E4 can increase your risk of Alzheimer's and then
Yeah.
also increase risk of cardiovascular markers. And so
Yeah.
there's
Isn't
so much
this
there.
so much there? I feel like I think we're both fans of this person, Dr. Dale
Yeah, I love
Bredesen.
it.
Love.
The Dale Bredeson's so good.
Yeah, he's great. He's had the end of Alzheimer's book, a few iterations of it, and then his new book coming out, The Age of Swing. But I think his cheeky terminology for it, is it like type 3 diabetes, right? For what Alzheimer's is.
Yeah, so good. Yeah. And I think, there's so much we can do. I love talking about this one statistic. I talk about it all the time. If you follow me on
Please.
social media, you'll see it. But,
Oh, by the way, her socials is great, guys. Great content, makes it easy to understand. Her stories are on point, and just walking
oh,
around with her dog.
appreciate. Actually, yeah, Kimchi is sitting over here. My baby.
You named it for a healthy food.
I know. Yeah, it's so funny. People ask me that all the time, and we're thinking, like we'll just start like naming all of our pets after fermented foods. Just gut.
Great for the gut, which technically
Yeah,
might be the first brain. So we're talking
I know.
about
Yeah,
Alzheimer's. So, anyways,
yeah,
go ahead.
I know. Actually, side note too that research shows that having a dog or a pet helps increase your microbiome diversity because of exposure to everything they
So
sniff.
kimchi really is kimchi.
Yeah, he's literally my kimchi. Um, so good. But oh yeah, no, this is why I also love, okay, so doing things, and I know that we nerd out on this, Seamus, because we're in this space, but doing things like, okay, so there's been research that shows that using the sauna 4 to 7 times a week reduces risk of Alzheimer's by 66%.
Oh, let's say that again. 4 to 7 times per week with the sauna reduces Alzheimer's by 66%.
Yeah, yeah,
Whoa. Can we talk
yeah,
about the mechanism of that? Is that because I mean, I've done my
it's too
research
cool.
on this, but there's a lot there. But we were just talking about saunas, but there's multiple types of saunas. But if it was just like a normal
Mhm,
sauna, infrared, what is it primarily like the mechanic there that's working? Is it because of the heat
mhm.
or is it because you're
Yeah,
sweating? Like what is the
yeah. Yeah, so most of the research is showing that when you get to a temperature in your body, you produce something called heat shock proteins, which have been shown to inhibit amyloid plaque development. And so that is what, can cause Alzheimer's. And then the other mechanism I've seen is that because it also, of course, boosts detoxification system, which can help clear out a lot of things in the body too. And so I would say that probably the combination of those two, but like you said, there's so many different types of saunas. So infrared, having to do with inflammation as well. But I would say like the specific study that I'm referencing was done on Finnish like population and Finnish sauna use, which is mostly just dry.
Statistic on the Finnish saunas. There's more Finnish saunas than there are Finnish cars.
I love that. Oh, so cool. That's such a good stat.
That's how much they love saunas. It's like 2 to 3 million saunas or something like that in there.
Imagine. I'm like, can we bring that to the US, please?
Yeah.
Everyone
We're need to go to Finland. Yeah. I mean, so here's a little bit on the saunas. What I love about this, because I have one at home with infrared. Me and my fiance use it like constantly. You can only do it like for like 10, 15 minutes every few days. But here's a little physiology lesson for you guys. Body fat. Look, it's an organ. Not just a tissue. It's a whole living, breathing organ. And the thing about fat is it's kind of like this waste drawer in your house, right? You don't know what to do with something. You put it in the waste drawer. You're like, or this like random corner, like, I got some mail. I got this little knickknack. You just put it in this corner. That's what fat is for like toxins, mycotoxins, all these things. And we accumulate that through our environment a lot. And if you're holding a lot of adipose tissue, that's a problem. Even if it's hypertrophy or hyperplasia of that fat tissue, if you gain more, you're just adding more toxins in there. And now you're putting it into an inflammatory state, like cytokines and things like that, because it's away from the blood vessel. So the physiology of fat is interesting. But if you can sweat through exercise, great. But maybe you're not always exercising. Maybe you need to recover a little bit. Maybe you're mentally like tapped out. A sauna could be one thing for you that could be beneficial. You can mentally de-stress, like we were talking about in this chat. But also at the same time, you're just hanging out in there and getting the sweat on.
I know, right? I love that too. Like you said, because I will treat it like a meditation when I go into. So it's like a dual kill two birds with one stone type of situation.
Yeah,
but
I feel like it's a warm hug.
Yeah, it is. It's like so nice to just relax in a sauna. It's just a really warm hug. But yeah, so that's, I think statistics like that and being able to recognize that you have so much power over your risk, is so helpful to remember when we're doing genetic testing for risks associated with diseases. And I remember, learning that and, thinking like, oh my God, I need to make sure that every patient knows that there's some control that they have over the future, and so of course, like you'd mentioned, some of these diseases, will come up randomly, and that's where we want to catch it early with screenings. But there is so much power we can do to prevent it. And so I think combining that and allows you to do the genetic testing, knowing that you're going to feel empowered after it and not scared of your risk.
Yeah. No, I love it. That's what I felt like when I did my genomics testing. Like I'm completely fine saying this out there. I was at risk for more joint injuries, and I was like, that tracks. I've injured myself a lot, so I have to be. It informs how I train. I love my training, but I have to really build up my tissue tolerance. I have to have some collagen supporting foods. I have to have anti-inflammatory, increased recovery things so that I can heal faster. So those are things. I'm also a bad methylator.
Yeah, it's okay. A lot of us are, but it's so important to know.
Yeah, and methylation is super important for like mitochondrial function and just cell anatomy. So it's like, oh man, I like need my energy, So I'm getting some B vitamins or some good fruits in there and just making sure, okay, that informs my diet. So it really is helpful. And I think, you get into a space, I think genetics gets this thing where, there's a lot of fear and stigmatism. Like, we're just like, oh, the stigma is, hey, it's just to see if you're at risk for something, or like you're going to be somebody that gets cancer or this. It's like, well, look, let's be smarter about it. These tests are getting better. They're getting online. Like you're doing the counseling. It takes someone that's a specialist in it that can, like you, really communicate well, like a good scientific communicator, not just a person that nerds out, but also knows how to connect with people and tell them, hey, here's the thing. Let's talk about a few more preventative things. I think I love this chat about just some preventative. I mean, that's a great stat there of like, hey, sauna use is going to drop it by 66%. Doesn't matter really, just get the sauna going. What are some other statistics that you love about certain genomics or lifestyle prevention things that are going to be like, whoa, that's going to drop, drop the mic for our audience here?
Yeah. Okay. One nutrient that I'm obsessed with that relates to genomics as well is sulforaphane.
Let's go. Let's go. Sulforaphane. I'm the best 4 minutes of like anyone on sale was Dr. Yale dropping the biochemistry of sulforaphane, and I was like tracking, and I was like, God, that was genius.
I know. I love it. So sulforaphane has been shown to also control and turn off or on over 400 genes. And so like when we're talking about, genetic expression, just this one molecule that's found in broccoli and broccoli sprouts can alter all of those genes inside your body is just so amazing. Specifically, associated with phase 2 detoxification, with inflammation, with oxidative stress, all of the things that, if unmanaged, can lead to chronic disease. And so we like to sprout our own broccoli.
Really? Yeah.
Yeah, broccoli sprouts. But there's so many good like supplement forms. And so I know some people are like, oh my God, so you're telling me to eat broccoli or cruciferous vegetables every day? And I'm
Yeah, and
like,
some people can't really handle that, like low FODMAP type folks, or people that
exactly.
bloat from that.
Yeah.
Yeah. What are some more practical ways, or like I'm not a bunny rabbit. I'm not gonna eat like a bowl of broccoli. Even me, like I'm not gonna do it. But like, how can I get that in to be easier for someone like me?
Yeah, yeah. So let me just say really quick too so broccoli sprouts contain more sulforaphane. I think it's like 100 times more sulforaphane than mature broccoli or something. And so that's why I'm bringing up broccoli sprouts for those who don't know. And like all you really have to do is get a sprouting jar on Amazon, get broccoli sprouts, put a teeny layer of the seeds in the sprouting jar, water it, and then they sprout. So it's actually really easy, and you could put
All
them
right,
on like.
I'm sold. Gonna go do that.
I'll have an affiliate link.
Yeah, no, if like we should probably get you one.
Probably get one. But yeah, and then you can put them on like omelets, sandwiches, in smoothies, like so many different ways. But also we will, like, obviously we're not going to sprout all the time, and they are distinct taste. So there's supplement forms that also have like mustard seed extract, which helps with absorption. And then I was just talking to a woman in the functional space who found these like green apple flavored gummies for her kids to get sulforaphane in, and they're so good. I'm like, they're my new obsession.
The parents in here love you, because I think Marcos and I have had our own set of guests about kids being such particular eaters, and it's like, if you can't even have your kid eat their broccoli, but you need to get their sulforaphane in to really help them with like genetic on and off things. This might be a great easy handle.
Yeah, they actually taste so good. Sometimes I'm literally act like a child and get gummies myself. And my fiance and I eat them all the time. I'll try to get the link if you share them like in the show notes or something. But yeah, again, don't have affiliate to them. I should, but they're like my new favorite gummy. So yeah, it's so helpful for kids too, and just adults who like gummies.
Yeah, sulforaphane. Let's talk about that. So the reason why sulforaphane is so good is because it works again in 400 plus genes or more or whatever, but it helps turn on and off these things. Tell us a little bit more about that.
Yeah. So this is so let's say you're born with a predisposition also to have your inflammatory genes turned on, because that can happen, then you're definitely going to want to look into how to turn them off, because what that means is, like, if you're exposed to something that's inflammatory in the environment, which could mean food as well, if you eat processed food, fried food, or sugar, your body could genetically give you an increased chance to have a higher inflammatory response than someone else. So we know that, chronic inflammation can lead to so many chronic diseases and lead to, increased risk for everything we've been talking about. And so the sulforaphane, again, like I mentioned, even though you're not changing the actual genetic code, you can basically put a blanket on the inflammatory genes. It's actually using methyl groups a lot of times, where you're putting blanket on the gene so that the gene's not being read, because our bodies basically read our genes like instructions in a book to do something. And so it would be as if you're either highlighting or crossing off a gene in a book. And so our bodies can't read that. And so you're not going to have that inflammatory response. And then again, being low in inflammation and, the other things as well can help reduce the risk, but also help you obviously feel better in the present moment, outside of prevention.
Yeah, I love that. It's so true. I think, man, I wish I knew this kind of stuff. I have a chronically high inflamed lifestyle. I mean, for those folks, like we talk about the gut health, like, I mean, the reason I got into this field is like, I've had a lot of pains. My 3x4, 3x4 genetics said joint stuff. I wish I knew that. I would have handled my training a little bit differently going into high school and college for my genetics. I tore my MCL, tore my LCL, my shoulder, all the L's. I got them all. But I also have something called psoriasis, which is like an autoimmune disorder. But it's like part of a chronically inflamed either gut, epithelium tissue. And it's like, oh, would have been great to know these things. But back in the day, when I was 12 years old, this is 19 years ago. What are they telling you? Hey, take this drug.
Yeah.
And what does that do? Well, it ruins your gut.
I know, and all these side effects.
And then you kind of just go like, well, holy cow, like why isn't there another way? I mean, that was just a system. In 20 years, like a lot has changed where more people are really bringing in the preventative side as opposed to, let me just go straight to a pill. Hey, there's cases where you do need to go straight to the pill. I'm not saying that Western medicine has its purpose.
Yeah.
But if there's a way to exhaust lifestyle, nutrition, I wish I had that. I think that's why this conversation is so important.
Yeah, it's so true. And I mean, sadly, like you said, even 20 years ago to now, that's still happening a lot. And like you'd mentioned, like, so sadly, people get put on medication and then they don't get a plan to get off of it. And so, like you said, sometimes these medications can lead to side effects. Also, things like nutrient deficiencies and can lead to another problem, which then another medication is given for. And then you're kind of stuck in the cycle. And I feel like we maybe all have experienced seeing this in older individuals where all of a sudden they're on 18 pills and they can't ever be off of them and they're just slowly deteriorating. And so you want to avoid that and be dependent on all those things because, and so like you said, I think pharmaceuticals can have a purpose and be so great, especially in short-term use. But if you are on one and you don't have a plan to get off of one, but like you said, so that's why I think the genetic testing is becoming more popular for parents to order for children too. Because imagine being a parent and having that knowledge for your child. Like, for example, you can test to see how your child will respond in glucose and insulin. Like, do they have a little bit of a predisposition to diabetes? But that is really testing for their blood sugar spike and drops. And so then you maybe have the knowledge they need more protein and less simple carbs, than maybe like, just how you were feeding your kid before to help them stabilize their blood sugar. So you can kind of get like so personalized with your health plan and have it be early on so that you have the time before symptoms arise to think about it.
I love what you said there. Gosh, it's a crazy thing because I see that in my day-to-day with my life where people are on a bunch of different medications and they could just never come off because they're just perpetually trying to manage like a disease state, but then that disease state has a side effect and then something else. Yeah, it's a little crazy.
I know. I was just thinking, like, I know we both talked about, our personal lives a little bit. Watching my dad, he has so much going on, but just a little bit of, like where this is coming up, where I've noticed this is he was put on antacids probably 20 years ago due to acid reflux. And so what started happening is his food was sitting in his esophagus and not getting digested. And so now then he developed a chronic cough. So now he's stuck on he's stuck on antacids and now he's put on cough suppressant that he needs both to even just survive and sleep through the night. And then the cough suppressant led to, like something else. And so now he has to, so that's like, I've just seen, I think a lot of people think, they just don't think about the future of like what could happen. And so it's like, if instead from a functional approach, if we were able to utilize digestive enzymes and tweak diet to handle the acid reflux, or, whatever is personalized to them, rather than just putting them on an antacid for 20 years, it could have avoided the whole situation to begin with.
That is so funny you say that, because it's like talking back to that like certain neurotic type of folks that I work with like food and stuff. They're like, oh, I have bloat, I have this. I'm like, well, have you tried, going for a walk after a meal?
Yeah.
And like
Yeah.
that helps sometimes with moving some of those digestive things.
Right.
Have you
Yeah.
tried maybe a little apple cider vinegar to just break up some of that thing, help with the acids in there? Okay. Have you tried digestive enzymes? And I
Yeah.
just try to titrate it and see what works best. So sometimes I think in the functional space, I think what happens in the medical space is with medicine and the person coming up with a problem, they need it solved now.
Yeah, exactly.
But the thing is, usually that now is a lifestyle issue, and most chronic things are from a lifestyle perspective. So
Yeah.
you're trying to solve something right now, but now you're going to pay for it later. Like you're saying, now you're on a
Yeah.
medication, but a year later you got side effects, you needed this medication, and now it's like 18
Yeah.
things
I
later.
know.
But you're trying to have such a quick result and want that instant gratification. Look, functional medicine and the integrative approach is a bit different.
Hmm.
It looks at all these symptoms, but we then give you protocols, right? Like the
Hmm.
digestive enzyme, like the things.
Yeah.
Now, it may not work right away. It may not do the thing you're asking for right away, but with that little bit of patience, you're going to
Hmm.
find something that is not going to have the audacious side effects that you're going to get from the Western medicine. Like, trust me, the Western medication, the pharmacologicals, the procedures, oh, it's going to be working. It's going to work.
Yeah.
This stuff works too. You just have to be a little bit more patient.
Yeah. Yeah. That's such a good point. Yeah. I think, and that's also the other piece to it, like you were saying, is that the quick fixes are also mostly band-aid fixes. And so, like you'd mentioned, with patients and with functional medicine, you hopefully can get to the root of the issue and, help support it so that, it might go away, rather than just continuing to mask it and then
Yeah.
not uncovering what's causing it.
Yeah, exactly. I think this is where the counseling comes in. Let's talk about the
Yeah.
counseling a little bit here. Like,
Yeah.
how do you help manage the personality types that come in, the people that are
Mhm.
frustrated? They're not necessarily coming in for preventative, like maybe these parents that are going to do a few things. Or maybe they are. Maybe they are neurotic. Maybe they are frustrated. Maybe they're all these things. How do you, as the counselor, come in there and kind of give them an understanding where they can calm down, realize, there's a lot that we can do here, and you're not as helpless as you think you are.
Yeah, I know that's such a good point. And yeah, like you said, the counseling piece is so important to genetics. And I mean, healthcare in general, but especially with genetics, because this can be so complex and it can be, um, heavy news. And so sometimes we just need to remove the information overload out of it and address what's going on emotionally. Because I've noticed that, I mean, and we also learn this in school, that if someone is obviously overwhelmed by information, they're not going to actually absorb anything you're saying.
Oh, I
So
had that. I had that recently, and this is why, like, my meetings, and all these things, are. I have notes going all the time, like through AI
yeah,
describing it.
love
Um,
it.
Having
Yeah.
like HIPAA compliant note things, because we'll have
Mhm.
with Synergenics in our day-to-day clinical work, a patient sees us not for 7 to 15 minutes. A patient sees us a long time, and there's a
Yeah.
lot of notes, and we got to give them the notes at the end of it, right? And that's what
Yeah.
sounds like what you're doing. You're like, hey, I'm
Yeah.
spending time with you. They're like, oh, this isn't a
Mhm.
15-minute meeting? No, this is time for you.
I know, it's so true. Honestly, like, especially when we're talking about diseases that maybe someone has a family history of and they just watched a family member go through treatment, like,
Yeah,
obviously it's going to be emotional for them. So, yeah, like you said, I think a big piece of our job is to really, be able to be empathetic, step into their world, what they're going through, what information could be good for them and helpful, and what doesn't maybe make sense to tell them at that point. And assess, of course, like making sure that as the provider you're not taking on too much, but being able to really like understand from their perspective and their world, where they're coming from, and then being able to kind of talk through the genetics piece and what we're finding in that light, if that
Yeah,
makes sense.
that makes
And I
sense.
know you're, I think you're like such a master at that. And I think it's like so important when you are, as providers and practitioners, it's like such an important piece. And like you had said, I think it's maybe something that's sometimes missing in more of the Western traditional realm, where
Yeah,
I don't think it's anyone's fault. I think it's kind of a systematic problem where patients are only having 10 to 15 minutes with their doctors, and you can't even get to the emotional side of things. So, I think it's such an important
yeah,
piece that as practitioners we're responsible for adding in for our
yeah.
patients.
I love that, and it's great that you're doing that because it's if you talk about this longevity stuff, we talked about community and purpose. I mean, the emotional health is part of that. If someone isn't
Yeah.
feeling like they're thriving or striving or in a great place, like disease
Mhm.
comes from the mind too, and
Yeah.
can really affect the body. We talked about stress mitigation and stress
Mhm.
practices, or
Yeah.
maybe even just a little bit of meditation, mindfulness can bring so much.
Yeah.
And I think we have to hold space for that in the clinical world. The world is changing. It is getting more fast paced. It is getting more all this, but I think we have to hold on to that. We have to hold on to that empathy. We have to hold on to these things because people aren't a number. People aren't just something that you're like, hey, let's just solve this thing and give you a band-aid solution. Oh shoot, we're
Yeah.
gonna see you in a year because now we got to fix something else. And I love that
Yeah.
you're integrating that counseling concept in your work. I think this is a great point. Maybe we can transition to this. If someone wanted to work with you, not a patient, but do you work with physicians? Like if a physician was listening to this right now and they don't have genetics locked into
Mhm.
their practice, but they're like, you know what, I need to bring this arm into it. This conversation has got me really locked in. Do you work with physicians? Do you like
Mhm.
come onto their practice and like you consult with them with their patient base, or how does that work with you?
Yeah, we love to work with physicians and practitioners. We always try to tell our practitioners who we work with that we want to make their life easier by being the interpreters and being the people who can place the order, work with insurance, work with the patient, get the sample so that we can give that information to the practitioner to make their health plan and their recommendations even stronger. Something that you had mentioned with, it's not a one size fits all. I think that's what genetics is bringing into healthcare, is this ability to not just have a one size fits all approach, but personalization. And
Yeah,
I think so, yeah, we love to work with practitioners, and our whole bread and butter is DNA. Kimya is a genetic counselor who works as part of the practice, and she just did a post where she said, you wouldn't go to the dentist for an eye problem, or maybe it was reversed, like for a toothache you wouldn't go to the eye doctor. So like, we wouldn't go to anyone else besides a genetic counselor to do your genetics. So that's definitely like our specialty, our obsession. And we love to work with practitioners and providers because we see that there's a gap where you can see all these specialists and then you're telling the new specialist all about your health problems when like it's just repetitive. And I think the true power to heal someone is when we all work together
yeah.
and we can collab. So we always love, we work with a lot of practitioners where we try to make it easy on their lives too by just telling, communicating all the information we found for the patient to them so that they're able to incorporate that into their practice.
Perfect. I love that. I think that's important. I think the collaboration piece is there. The more holistic approach, being able to delegate that to the specialist as opposed to taking it on. I think the best, we really hung out with some of the best doctors and physicians in their space, but they really owned their space and they said, I have a team.
Yeah.
And I think that's great because it can give the person listening to this or someone that's working like, oh, working in precision medicine, working with a team, that all these different specialists are there and now they're coalescing all this health information for me to come up with
Mhm.
a lifestyle plan. Yeah, whether there is some pharmacological interventions, yeah, if that's indicated for, or it's just supplemental nutrition, looking at my lifestyle, looking at my sleep. How do I manage stress? What's my mental health looking like? I think
Yeah.
that's going to be super powerful. I think when medicine can really become that space, I think for our country, I think we really look at lifestyle components that bring people back to the hospital, the emergency room, those will really come down. I think we're
Yeah.
really far from that. We're really far from that because the statistics aren't looking great. But
Yeah.
yeah. And you mentioned Kimia as well. She's going to come on the pod soon enough too. And she's going to
Yeah.
talk about pharmacogenesis, which is like a whole different thing. Can you do a little intro on what that is, what she's like
Yeah.
specializes in?
Yeah. So to break down really quickly what we specialize all together. So between me and her, so I focus mostly on cancer, Alzheimer's, heart disease, and lifestyle and nutrigenomics. And then Kimia specializes in pediatrics, so children, preconception, so before starting a family, connective tissue disorders, and then pharmacogenetics and pharmacogenomics. So that specific topic is such a cool area of study that's also just so underutilized. And what it is it's looking at how your genetics will metabolize and respond to medication. So like we've
Yeah.
been talking about, medication can be so important. And it's not that, like, I fully think that everyone at some point will probably take a medication. It could be anything from even like pain medication if you're going through surgery. And so we have the ability now to detect if you will be more likely to have adverse side effects with a certain medication. Also, what type of medication would work better for your body based on your DNA. And lastly, how much of a certain
Yeah.
medication you may need, like your sensitivity. And like, how powerful is that if we
Yeah.
are going to use medication, like, why aren't we using that test,
Yeah. No, that's awesome. No, I love it. I think the field is like booming, and I love the fact that
Yeah.
you two are sharing in that space. And I think with
Yeah.
Golden Genetics, you guys are helping people out. People are coming to
Yeah.
you. They're getting the counseling. They're easing their mind on any lifestyle things like you've talked about. You've literally seen people on their dying bed, and then the families the next day to let them know like, hey, this is what the risks were. This is how we got here. I
Yeah.
don't think I don't think if someone's listening to this, I don't think they need to do that. I think they can be a
Yeah.
young person or a young
Yeah.
informed person, like, hey, go ahead, go grab the test. It's once in your
Yeah.
life. You get the
Exactly.
counseling. You always
Yeah.
have those resources. And then now you start working on those lifestyle things. Eh,
Exactly.
Even if you think it's too late, I think you could be in your mid 40s, 50,
It's
60. You
never
just
too late.
never too late.
Yeah.
Do it, make those changes, and then you've got like a team of folks supporting you make those changes. Now, Natalie, we are at an hour. I want to be disrespectful of your time.
Yeah.
If people want to work with you, where can they find you? What's the process like, and what can they expect when they, get to be in your sphere?
Yeah. Yeah. So mainly our main package, we always will see patients for an initial session. Everything is virtual. We are a virtual company right now, which means we can see patients all over the nation, which is really nice. So we'll meet with you for an initial session where we review your personal and family history extensively, and also talk about the different types of genetic tests and some genetics education. This also allows us to make sure that any genetic test we order makes sense for your goals. And if we see anything in family history, we can bring that up for you. Then we'll place the test orders. They get shipped to your house. Most of the time, they're just saliva or cheek swabs. So we have come to the point where we can accurately sequence DNA through saliva or cheek swab samples. We only, in special cases, need blood, which is amazing. And then we get your results. We will interpret them for you and create a plan, a protocol, and then meet again for a Zoom session to review those in detail. When I say detail, it's a lot, which we love to nerd out on. But again, we will assess where the patient is at. We can always kind of zoom out a little bit if
Yeah.
needed. But we do love to nerd out on each gene variant we find. And then we'll meet with you again for one last session to make sure that all your questions are answered. And then we create documentation for you and then any of your providers you're seeing, so that everyone's in the same loop. And so that is mainly how we work. Our main package, we have different packages for different indications as well. But I always tell people to please reach out to me if you have questions. I really just want to help. So if we can't help you, we'll definitely guide you to someone who can in the genetic space. And so you can find me at Golden Genetics Health on Instagram. Also, my website is www.goldengeneticshealth.com, where you can find ways to text and email me. And then my email is natalie@goldengeneticshealth.com. So
Perfect.
either way, yeah,
You
reach
got
out.
it. That's perfect. We'll get all those in the show notes and links. But I think for the folks listening to this, and you're like, man, like I got to do this. Do it. Jump on. It's only one time, but you get the person that's a professional to help you on there and really guide you through that. I'm telling you this right now. Like I have enough savviness in science and all this stuff to get an understanding, but I do not recommend Googling a test and then like going
Don't
through
do
all the SNPs and polymorphisms, and then it's kind of like going on PubMed MD and going like, I have a stomach ache, and then thinking you have stomach cancer because
that. And there are really not good genetic tests out there. People, sadly, like genetic testing companies have blown up and marketing has been really good. But like there's some genetic tests where you pay hundreds of dollars for just 5 genes that aren't that important for you.
yeah,
And without proper interpretation, it can do more harm than good, like you were saying.
yeah,
So we
yeah.
highly recommend not Googling or just using the Instagram ad that you were spammed to order your genetic test.
Yeah. Work with a professional, and work with someone that's
Yeah.
been in the trenches, that's seen the dark side of it, and now is trying to put out the light. And just work with that person, because I think what it's going to do for you as a person is like you can forgo the money. It's a few $100 for some counseling and some testing, but you are now loaded with the information that's going to set you up for a great life, your kids' life, your family's life, and once you get them in that circle, everyone's like going back to the beginning of this conversation, making the decisions that impact their lives to be better. So
Yeah.
yeah, I love it. I'm like looking forward to this. I can't wait for people to get their hands on, this talk and really get to connect with you, Natalie. Like we said, we're bonded for life now. So
Yeah.
we'll be making sure to share this. Anything else you'd like to share before we close off here?
No, I think we covered it all. I appreciate it so much. I'm looking forward to having this episode air too. And then, yeah, looking forward to connecting and listening to you, to Kimia's as well. Everyone be sure to listen to that one too
Yeah.
if you want to deep dive into more genetics.
Awesome. All right. Well, Macropod peeps, I hope you guys like this one. Like we said, deep insight, nerding out, but you got to get with the professional. Get with Natalie, guys. goldengenetics.com will have all those show notes. All right. Have a good one. Thank you, guys.